Morning, Julia.
Thank you so much for joining us once again. All this focus on the booster vaccine, I mean, absolutely makes sense to make sure that the most vulnerable have that extra protection as we have this spike in cases coming. But again, this is going to be sacrificing a lot of other healthcare, which many would also say was important.
Yeah, I'm very much pro-vaccine. I've had 3 vaccines myself. But we were told that the GPs would stop doing the over 75 routine checks, which I don't think they were doing anyway. But I got a text from my GP practice, because I have to be registered with the GP, last night telling me that they're just shutting down the online access that we've been using for several months. I got a text at the end of October saying, here's what to use. And they've sent last night, no, don't use it, because everyone's working on giving vaccines, which I actually don't understand. There are plenty of people other than GPs who can give vaccines.
Yes, you don't need to have 7 years of medical training and many years of experience in order to give a vaccine.
No, you don't. If you remember, about a month ago, the GPs were going to be going on strike, Julia. That's gone very quiet, and the health secretary has very cleverly finessed this, because as far as I'm aware, the GPs do get extra pay for every vaccine they give. So this has kind of satisfied the GPs and boosted the vaccine program, but at the cost of those poor, vulnerable people who can't get in to see their GP.
Yeah. And we already know the cost of this, because we're dealing right now with a whole load of what would have been routine treatments and operations in the NHS, but they are now emergencies because they've been delayed for so long, particularly from the first lockdown, and also people who've not been able to get an adequate or proper diagnosis because they've had only online consultations. I mean, I'm pretty tech savvy and I'm pretty sharp elbowed, and I've got an ex-GP as a mother, so I know whether to bother my doctor or not. I find going through the electronic system to get through to my GP, I mean, unbelievably laborious, time-consuming, and very irritating. I can understand why many people would simply give up and go, oh, I'll leave it, when actually those are the people who desperately do need to get in and see their doctor.
Well, it's worse than just delayed treatment. People who are dying because they haven't been treated early enough. I've seen them face to face. I saw a woman 2 weeks ago with ovarian cancer. No one had ever put a hand on her tummy. She had metastases spread all through her abdomen because no one had examined her in a year. And that's happening all the time, all over the country. It is. Well, but no one's doing anything about it. And this latest thing, I simply don't understand. I was actually very upset to get a text from my GP practice. Fortunately, I don't need to use them. I have neighbours down the road, a couple who are very, very unwell, who've been using the online access. It's the only way, because you can't walk into the doctor's surgery. It's the only way they've been able to access it. They are very, very distressed now as a result of this text having gone out. And I simply don't understand why no one's making more of a fuss about it.
Well, we will try to make more of a fuss about it, but this is the thing. When the only stats that are on the television and the newspapers and on radio every single day in the headlines are stats about COVID, then no one notices all the people who are dying of stomach cancer and skin cancer and heart attack. We're not seeing those stats, and this is the thing. We've failed to learn. Well, I say we, you and I, and my listeners, we've learned all the lessons. And we're, certainly my listeners, I'm largely not experts in this, apparently. And yet the people who are in charge of the NHS and the GPs and the health department and number 10 seem to be, they acknowledge the problem. Sajid Javid, I was very encouraged when he was appointed health secretary over Matt Hancock after his resignation, that he actually acknowledged there was this massive waiting list and we had to get on with routine operations. And now suddenly everything's going out the window and it's back to the National COVID Service. And the reality is, you know as well as I, look, the evidence suggests this is more transmissible. That's going to mean a lot of cases at the same time, but less severe. That could still mean massive pressure on the NHS. But that doesn't mean that we just throw out all the cases for cancer and heart disease and everything else as if they don't matter.
The data is there of excess deaths from cancer, heart disease, as you say, mental health issue, and we're now seeing child protection issues as well, all as a result of over-focusing on COVID. And the data is there, deaths at home because people have not even tried to go to hospital. They're frightened to go to hospital, so they're quietly dying at home. And in excess of what should be at this time of year. We can compare this with other years. Non-COVID deaths are much, much higher than they should be. And that's a result of the health service not delivering the care that people need.
What do people do about it? What can individuals do
Well,
about it? You can't just sort of go and
look,
just bang on the door of your GP
no,
surgery demanding to be let in. They'll just call the police.
there's not one. I mean, people are going to A&E because they can't get in to see their
Yeah.
GP. And in fact, a lot of GPs are saying go to A&E, but that moves the problem along somewhere else. I don't think people should be forced to pay. As it happens, as you know, I'm a private GP and we're very busy, but I'm not here for self-interest. It's not what I signed up to do, to force people to have to pay to get the basic care that they're paying for already through their taxes. I'm sure your mother would never have sent a letter to her patient saying, don't bother me, I'm vaccinated today,
No.
because she cared. And when I was in the NHS, I was 24 hours a day, 7 days a week responsible for my patients. I had a list and I worked every day, but I'm afraid things have changed dramatically over the last few years. And to see the doctors sidelining themselves into an easy day, nice day, doing vaccinations all day, you're not going to have any arguments with patients or have to write any referral letters. You just get the needle out, have a nice chat. You do 50 of those a day. That would be a nice day's work. I would love to do that. It'd be much easier than what I do now.
But that's the thing. Have the people who now work as GPs, who now work in the hospital, have they become a sort of different breed of people? Because I certainly, having been the daughter of a GP and having and having known a lot of doctors, through her network of friends, these are people who were, like I think the GPs in my own surgery where I go, people who are dedicated to helping people. Straight A students who could have gone into the city but decided to go into medicine. Yes, I know it's a nice high status, high well-paid job, but nevertheless motivated to do something worthwhile. And I can't think anything much more worthwhile than being a doctor. And yet apparently not caring about the patients who've got the wrong diseases.
They are a different generation. I'm currently trying to recruit a doctor to work out of hours. Sundays, I mean during the day, not evening, not nights, not home visits. I cannot find a doctor to do that. And if there's anyone listening that wants a nice job in private practice on a Sunday, the doctors aren't there. Why? Because they want their work-life balance. Sunday is a day when they don't want to work. So I actually work Saturdays now. I'm going to have to be coming in Sundays because I want to provide a 7-day-a-week service to my patients. I cannot recruit someone. It's not even a question of money anymore. It's a question they've got enough work. They've got enough money. They can earn that in the NHS. They're actually well paid, so they're not hungry anymore to do more work.
Okay. Dr. Laurence Gerlis, it's so depressing, but thank you for